In this session on leadership, we are joined by, first of all, Sue Macdonald, who is the curator of the Maternity and Midwifery festivals and is currently doing a weekly programme on the Maternity and Midwifery Hour to try and fill the spaces that are left by being able to meet, and by Professor Lesley Page and Professor Soo Downe, who are going to give us their thoughts and reflections and take part in a discussion on some of the leadership challenges that are facing midwifery. We're facing it before and we'll face it afterwards, and have been immensely complicated by the current virus. So first of all, we're going to start off with, so welcome to everybody. And I'm going to refer to Sue Macdonald as Sue Mac and Soo Downe as Sue, just for the avoidance of confusion and for the help of those people that are listening to the podcasts. First of all, Lesley Page was president of the Royal College of Midwives. She was the first professor of midwifery in the UK at Thames Valley University in Queen Charlotte. She's a renowned international academic. She has been a good friend to the Maternity and Midwifery festivals. She's a visiting professor of midwifery at the Florence Nightingale School of Nursing and Midwifery at King's College. And she was made a commander of the British Empire for services to midwifery in 2014. There's a much, much longer list. And I know from what Mary Renfrew was saying earlier that Lesley is part of the team of professors who've been working all the way through the virus, are trying to provide advice and also to monitor what's happening. So Lesley, welcome, and over to you for your thoughts on where we find ourselves.
Neil, thank you very much, and thank you for the opportunity of talking today. Professor Soo Downe is also a part of the Professors Advisory Group, and we've been doing some really exciting work looking at the evidence and reflecting on it in the life and the nature of COVID-19. And I suppose that when we reflect about the times we're going through, it is absolutely extraordinary. Mary Renfrew this morning talked about both the catastrophic impact of COVID-19, the pandemic, on every aspect of our lives, on health services, on individuals, on education, on poverty and inequalities. And she also talked about the positive opportunities. But I really have to start, because it's International Day of the Midwife, in honouring midwives who are working in the health services and in education. And sometimes when I see stories of midwives and nurses who are living away from home so that they can continue to practice without endangering their families, and I join in the clap for carers on a Thursday evening, I'm really touched by what we're calling the heroism, the dedication of midwives in the maternity services, but all of those who are working in the maternity services. And Mary talked today about the tremendous effort that's going into science, into policy, into discovering knowledge about this virus, which was new to us about 4 months or so ago. So it's a time of huge uncertainty and of fear. And in a time of uncertainty and fear, leadership is absolutely critical. And when I think about leadership, I think not just about the heads of midwifery or the clinical directors or the people managing maternity services. I talk about everybody involved in the maternity services. And of course, that includes users of the services who are helping drive forward woman-friendly, woman-centered services. And this leadership, I think, has to be compassionate. It requires that we understand the experience of people who are working in health services, in education, policy, and science development. And probably the most important thing that we can do in developing maternity services and developing policy is to focus on human connection. because we don't know. We don't know where we're going to end up. We don't know the impact of social distancing. And one of the points I want to make is that human relationship and human connection are going to be absolutely critical if we're going to emerge from this pandemic with our humanity intact. And midwives have a huge contribution to make to building that human relationship. Roy Lilly talked very eloquently this morning about the relationship between women and midwives, midwives and women. But it's also the relationship of the baby, the close and loving family relationship of the baby with the mother, with the partner, with the whole family. And the question for me is, how do we as leaders stop turning the clock back? And when we first started to deal with the pandemic and took measures to socially distance each other from each other, I was really concerned that we were going to turn the clock back, that we were going to lose water birth, continuity of carer, home birth, community services, and the continuity of carer relationship between midwives and women. But now we're seeing signs that actually we're stepping up, and many leaders of midwifery are now increasing home birth rates, strengthening community services, which are absolutely critical in a pandemic, using evidence-based care, sustaining human rights, sustaining the relationship with women. And what we're seeing is charities stepping up and making sure that midwives and nurses and doctors and everyone working in health services is well fed. We've at last got a recognition of the importance of midwives, nurses and doctors and the health services, and the importance of them having breaks, being respected and being well fed. But my concern is the impact that this is going to have on inequalities. We will undoubtedly see more austerity. The economy is being turned upside down. What will be the impact on the health services? Will we be able to maintain the quality standards that we're implementing at the moment? And I think that for leaders, being a politician will be absolutely critical. Making sure we keep the heat on the politicians so that once we've started to emerge from this pandemic, we don't forget what they've said about how important midwives, nurses and doctors, maternity support workers, everybody working in the health services are to us as individuals and to our economy. So to me, leadership will be about compassion, about working with others, about being mission-driven, having a clear sense of purpose. And the one point that I want to make is that the purpose of midwifery is really clear. It isn't just about saving the life of the mother and the baby, although that is, of course, supremely important. It's making sure that every baby and every woman becoming mother has the best start in life. And actually supporting that close, loving relationship is absolutely fundamental. So midwifery is also about quality of care, using evidence, sustaining human rights, but fundamentally making sure that every woman, every baby has the very best start in life, and that the family is integrated and that they can work together in close and loving relationships. And it's only with that human relationship and with developing our humanity that we're going to emerge from this pandemic as a more compassionate society.
Okay, thank you very much, Lesley. And quite a number of very strong themes there about the impact on inequalities, but also keeping the human connection. And it's interesting. Can I just ask you, I mean, the practice of midwifery is so intimate. It's so based on the human connection. It's been so based on face-to-face, even as modern medicine has improved what we can see, what you can test for. Nonetheless, it's a process of connection over a number of months, and there has been a distancing even within the services. How do you think that's impacted not just on the relationship with mothers, but on the midwives themselves?
I think we will probably only know after the worst of this is over. But we do hear stories of midwives experiencing burnout, having mental health issues, being extremely anxious. And we just have to imagine what it's like being in the personal protective equipment and relating to women. And so I think it's really important that we care for midwives as we care for women who are pregnant. They're both the same. It's a reciprocal relationship. And keeping midwives safe is absolutely fundamental. And the support that they need is absolutely critical. So I think we're learning a number of things. I mean, we're learning to use technology, and I think that there is the opportunity through technology to provide midwives and everybody working in the maternity services with the ability to feedback, to listen, to understand what they're going through. But in a situation like this, in the kind of crisis that we're in, it really helps to remember the purpose of our work, and the purpose to give the mother and the baby and the other parent and the family the best start in life. And I think leadership is about recognizing that midwives are doing that, giving them the opportunity of doing that. But also, I worry about us talking about heroism, because actually, we then get into a situation where healthcare workers feel that they've got to be heroes. But actually, they need to look after themselves. They need to take breaks. They need to feed well. They need attachment to their own families. So I hope at the end of all of this, the government will recognise that actually the work that midwives do is absolutely critical, and that they're given the best conditions to work in, and that they're paid fairly for the work that they do.
So, Macdonald, what's your reaction to Lesley's comments?
Well, I totally agree with Lesley. So, and I think the kind of heroism idea has been sort of talked about a lot, but it is important to focus on what you as a midwife are there for, and also to make sure there's a whole kind of system to support midwives. And I think what's been very positive over this last few months has been the level of support from the public and the positive feeling. And I would like us to be able to keep that, because I think that helps midwives who are feeling stressed to know that people care about them and people see them as individuals. Because I think otherwise there's a danger that the midwife just becomes the servant without any thought that she or he has their needs as well. So I think looking at the systems after we've moved out of this crisis, making sure we've got support systems, because we don't know what the long-term effects will be on the public or on midwives or other practitioners who are working so hard to look after mothers and babies. We're going to have to keep and that probably gets into the research that will need to be done.
Lesley?
I just wanted to say too, I think it's about acknowledging what midwifery leaders are doing. And I think I said earlier that we're now seeing leaders who are actually finding an increase in home births, an increase in community services, who are sustaining water birth, continuity of carer, all of the things that are important to safe care and about reducing the infection and the risk of COVID-19. So in the beginning, we had this knee-jerk response, and it was a kind of crisis response. And we're now seeing services in which these quality, this quality of maternity care is being improved and increased. So I think a lot of it is about acknowledging the very real work that midwife leaders are doing in an incredibly challenging, extraordinary time.
I think, yes, there was a lot of evidence that in the very first weeks of the lockdown and the crisis, services were heavily centralised. Yeah. Lots of places saw their water birth pools being either reduced or the facility taken over for other uses. Home birth services were cancelled. And it is interesting that midwife leaders locally haven't waited really for government guidance. They've pushed back against that quite strongly. Has anyone got a figure on an impression about how many home birth services or what percentage have been restored, even if not to the full degree? Lesley?
I heard this morning that there might be an increase from 3% to 6% of home births. And, you know, in the beginning, I thought we were going to lose home births completely. My real fear was that we were going to lose all of those services. There would be complete centralisation. And it would have been catastrophic because actually it makes sense for women to give birth at home. You know, they avoid the kind of cross-infection from the hospital. And women themselves are seeing that it makes sense. And the innovation we've seen has been amazing, you know, because there was difficulty with ambulance services and midwife leaders have engaged private ambulance services. So this innovation, the ability to think outside of the box, is really critical to leadership at any time, but particularly at a time like this.
Can I ask if you think it's made a significant difference that there are now a larger number of consultant midwives in the clinical area? Completely anecdotal evidence from what I've been listening to, but people saying that the teams have worked very well together with other clinical partners, and that one of the key things about a growing respect about the way that the crisis has been tackled has been that level of leadership, and in some cases specialism. I was trying to think how widespread that was when there's been, previous crisis, whether it was swine flu or the SARS in 2003, although they didn't really come to our shores. Do you think that's made a big difference?
I do think it's made a difference. It's both students now being involved in giving clinical care, academics, consultant midwives. And actually the interdisciplinary work in the United Kingdom has been phenomenal. The RCOG and all of the colleges working together with the RCM, the joint policies coming out, and we've contributed to those policies. Soo Downe's one of the group, Mary Renfrew's one of the group. So this interdisciplinary work that's happening is really phenomenal. And I think what happens in a crisis is that everybody has to stick to the knitting. You don't go to extraneous meetings. You don't do extraneous work. You focus on what has to be done. And we've all been absolutely focused on this. The danger period, I think, is when we stop the lockdown, when we start to emerge, when we go back to what will not be the normal that we had before. And I think that that is probably, in many ways, going to be more complicated than the lockdown and the point at which everybody was absolutely focused on stopping the spread of the infection and quality of care in the light of that infection. And so the next probably year is going to be absolutely critical, and we've got a lot to learn, and I hope that we'll learn. Mary Renfrew talked about the positives that have come from this, and it will be important to keep the positives. But the final word that I want to say really is that we will see huge poverty. We're looking at having an economic recession. I hope it can be prevented. It's doubtful. But I think we really need to watch what's going to happen to the socially excluded and to people in the population who are living in poverty.
Well, on that challenging note, let's turn to Professor Soo Downe, Professor of Community Health and Midwifery at the University of Central Lancashire. Lesley mentioned that we might see some turning back of the clock. But in a lot of your work, you've been working to give women more choice and to open up choices and options for them and taking control of their birth. What's your reflection on what you've been seeing around during the COVID virus, but also any comments you make about the longer term prospects? Sue?
Yeah, thanks, and hi. I mean, just building on what, I agree with everything Lesley's said, obviously. I think maybe I want to go a little bit beyond maybe COVID and the UK So a slightly broader sweep on the nature of leadership, and it is building on what Lesley said. So it kind of just takes it that bit further, I suppose. And one of the things I wanted to kind of reflect on was that this issue that leadership is not management. There's a difference between leadership and management. I think often the two get conflated, and often problematically, I think, and this happens to midwives as well as to others, midwives who are good leaders end up in management roles, which isn't necessarily the best place for them to be, because what the leader tends to be is a kind of charismatic, visionary person that has, as Lesley says, a kind of mission, and is able to bring people with them. And quite often a leader is a maverick. It's somebody who flouts the rules to an extent in the attempt to reach that final vision and to bring people with them. And I think one of the things that we're seeing, again, as Lesley said, in this pandemic, not because of the pandemic itself, but it throws a mirror onto this difference, is that there are leaders in midwifery and beyond who are actually saying, because if you like, the kind of the general bureaucracy, which again Lesley was alluding to towards the end of what she was saying there, the general bureaucracy that fixes a system has kind of been swept away, and so this is a space in which leaders around the world can actually really begin to shift the agenda, so-called tipping point moment, shift the agenda into something new, and I think that the opportunity we have now is to value leadership in that space. And also to recognise, of course, that leadership can be a bad thing as well as a good thing. And if you've got somebody who's highly charismatic but leading you down the wrong track, populism or whatever it might happen to be, then you can end up somewhere you don't want to be necessarily. So this is also about recognising where leadership is taking the profession and the whole kind of area of maternity care into a space where women and families can have more choice and can have a positive birth experience, which is the thing that we're particularly interested in. I think the other notion, and again it builds on what Lesley was saying there, is this idea of leadership being about courage. So having passion, but also being courageous. And I think again we have seen that really brought to being really highlighted. And I've heard stories, again this is in the UK, but I think it's happened around the world, of midwives, clinical midwives, who have actually taken huge amounts of courage in their hands and put in practice new things that sometimes have led them. And one particular individual who was told that she was being a traitor because she was proposing something that was actually a benefit to the women, but seen as being counter-cultural in terms of the organisation that she was working with. But actually the thing she was proposing was going to be very, very, well, A, it was evidence-based, and B, it was going to be very effective in terms of what women want and need. So sometimes leadership is about taking a risk, exposing yourself to not necessarily very pleasant kinds of experiences, but with the knowledge that in the long run, what you're doing is going to deliver something beneficial. So I suppose that's a very long answer to your question there. But anyway, that's my sense that this is separating leadership and management, so that we actually value leadership as something which is about taking us creatively somewhere that we might otherwise not dare to go.
Okay. Can I ask what feedback you're getting from your international networks? Because obviously our television screens are full of what's happening in the UK, and we're getting some feedback and things. But there's quite a lot of international work and comparisons going on. And this was meant to be, the kickoff of the International Year of the Nurse and the Midwife, putting those kinds of professionals at the centre of primary healthcare, that they could make the biggest difference fastest. What feedback are you getting from, there's 100 countries are in lockdown. Are you getting any feedback from your international networks?
Yeah, absolutely. I mean, the same kind of issues, well, in fact, in some countries far more acute, the same kind of issues that we're experiencing in the UK are happening around the world. And there are lots of people that are setting up various leading various initiatives to try and address that. So Sarah Spaden, for example, in Canada, has set up a whole network of people working on research and practice and sharing good practice. The White Ribbon Alliance is sharing instances of good practice so that people can learn across the piece from those areas where things have worked really well. There's a midwife working in the Bronx with, picking up on what Lesley's point about marginalisation, working in the Bronx with women who are very marginalised, BME women who are very marginalised, trying to set up a whole network of pop-up midwife-led units against quite a lot of opposition, because, you know, as she was saying, some of the private hospitals have a lot of resources, but they're not sharing them with the public hospitals. So certainly in jurisdictions where medicine, where healthcare is largely privatized, I think there are even more issues arising than we might have those of us in countries where you have more public kinds of medicine that are available, public kinds of healthcare that are available. And on the other hand, there are also private institutions that are doing amazing things, you know, that are private healthcare institutions like the Fernandes in India, who are really reaching out to more marginalized women and supporting them in this situation. So I think that the notion of I mean, leadership can operate in any situation and under any kinds of constraints, and the different constraints in different places. And there's definitely evidence of it at all levels around the world, I think.
Lesley, are you getting feedback from your networks?
Yes, I am. And I think that what I wanted to talk about, build on what Sue said, is that, for example, the World Health Organization and UNICEF are providing amazing resources, easily readable, evidence-based, that are important to everybody. And through the International Confederation of Midwives, and particularly around International Day of the Midwife, there's a huge sense of community. But I do worry, I have particular links with Brazil, and what's happening in Brazil is really frightening at the moment. And in many parts of the world, for example, the United States of America, there is often a proposal that mothers and babies are separated automatically to prevent cross-infection, which of course is the worst thing that we can do. So we do see around the world extremes of response to what's happening. But actually this international community is really important to us, and understanding what's happening around the world is absolutely critical to us. And the scientific community, of course, is coming through with very rapid work, which helps us understand the virus, our response to it, and to think about the unintended consequences of responding to it as well.
Sue Macdonald, your thoughts on the international side?
Well, I think I can't really add very much more, except to say I think it is a sort of microcosm of you've got different places are doing different things, and I think what we need to do is be able to learn the good and the bad, actually, of what's happening. And that's why having such good networks is so useful, because then you can kind of pick out the things like the Americans separating their mothers and babies, which we think is abhorrent. But you know, you can learn that's not the right thing, I guess, from our point of view. I mean, I was just I was sort of onto a plane of thinking of how we can encourage these mavericks in whatever country, especially in countries where the status of women and midwifery is a very women profession. How can you encourage those mavericks, especially in those countries? Now, Sue might have the magic answer. Lesley might have the magic answer. I think it's a struggle.
Well, I think one of the problems is that often where there are far-right regimes, there is oppression of midwifery and of home births that's actually taken into the courts. So I'm seeing friends and colleagues of mine who are being stopped from practicing through really draconian methods. And I think we have to be really aware of that. And I think Sue is absolutely right. Being a maverick is probably one of the most important parts of effective leadership. But there are parts of the world in which being a maverick is extremely dangerous, and you can end up in legal proceedings, even in prison, if you stand up and you support home births or you support midwifery. So I do think we have to be aware that there are parts of the world that aren't quite as tolerant as others, and support our colleagues in that situation.
Yeah, I agree. And I think you know, one of the examples that we often cite is Joanna in Bulgaria, you know, who was working in such a situation and has managed to set up, you know, a midwife-led unit in Bulgaria, which is entirely amazing, but against huge stress and oppression, but also with a lot of help from both midwives and obstetricians from around the world. So I agree, Lesley, it's about recognizing that sometimes people, the other thing with leaders is sometimes they are very single-minded, and they will actually pursue something with passion and bring others after them, and often what is needed is this notion of first followers, so people who follow these leaders, because it's the followers who make the leader is the kind of notion. And I think it's something that maybe for all of us to pay attention to, that, if you see somebody who's doing something good, then follow them, because actually that's how you make it become more mainstream. If you lead them by themselves, they will end up, being wiped out by the process. But if you have the courage to follow the leaders who are having the courage to lead, then ultimately it becomes very difficult to resist that, which is, nobody has to do that. It's a difficult thing to ask, but ultimately that's probably what's made the most change around the world in the most situations to any political system, rightly or wrongly. So I think that's it seems to me that the best leaders kind of combine the fire and creativity and passion with insight and understanding, and the best leaders are also probably diplomats, and that's not always easy for a leader to be, as you say, Lesley, is important. But if they're not able to do that, they need other people around them who can do that. And in building a kind of cohort of people, that's with a balance of skills, that's the way that leadership can actually be effective, and the best leaders do that, I guess, as well.
Lesley, you mentioned Brazil, and there are significant differences in the degree of medicalization around the world. And Brazil and Mexico are often quoted for the very high numbers of caesarean sections going into hospital pre-planned. But they're also very divided societies where, when they face the virus's full effect, it's really going to be two societies, one that has access to healthcare and one that doesn't. Just say a little bit more about Brazil, because I think the sheer contrast between where other societies are starting from, I think would surprise some people.
Well, first of all, I have to say about Brazil was where I learned about the humanization of birth. And, I have to give them credit. And Brazil is really an example of how big politics, the political regime, impacts on maternity and midwifery care. Brazil had a program of humanization of birth, which is now being turned back by a totalitarian regime. They had started to reduce, they were the caesarean section capital of the world. They were starting to reduce their caesarean section rate. There were birth centers. There was a huge program of humanization, which is now under pressure. But as you say, there are big inequalities. And I understand from my friends and colleagues in Brazil that the favelas, for example, where many of the less prosperous people live, there is really very little counting of deaths, of morbidity, of illness, and that they've been left to get on with things. And it doesn't have a public health system, for example, like the United Kingdom and other high-income countries. So I think that we should watch Brazil with interest. And of course, Brazil is famous for a president who denies climate change, who is allowing the Amazon forest to be cut down. So we often see a whole picture. But the amount of work that Brazil did in the humanization of work was absolutely mind-blowing and inspiring, and I admire them so much. So I hope as an international community we will help Brazil and other countries to actually preserve that humanization of birth and be aware of what's happening to them. And of course, a country that's really of interest to all of us is the United States of America. We're seeing this division of state governors who are actually being very progressive, who are being very educated in managing COVID-19, the pandemic. But a president who's pushing for them to have assemblies, election assemblies, and to preserve the economy. And I think that I'm seeing two things happening in the world. We could emerge as a more compassionate, more understanding society, but we could well go into a society around the world that's extremely divided between those who have and those who don't. and we might lose some of the progress we've made. And what's happening in the United Kingdom at the moment, I think there's a huge amount to encourage us, because politicians are actually talking to each other in a human way. We went from Brexit to COVID-19, and we're seeing relationships emerging. So I hope we continue to see those relationships.
And in the international networks, if you go to the other end, what's happening in India, or what's happening in some of the Middle Eastern countries where women still have difficulty getting access to doctors or midwives during birth. At that other end, any feedback from the sort of the extreme difficulties that they might be facing? Or is it just more of the same, that the virus will hit them, but it may not change much the poverty and difficulty they face anyway?
I mean, I think so. Talking of India, you know, I think it'll be interesting to see actually how it does hit some of those countries, because at the minute their rate per million is very low, interestingly. So, you know, it may actually be this is one of those things that we all assume is going to hit countries because they always get hit, but actually it doesn't, because actually it's hitting a different kind of population. So that'll be interesting to watch anyway. I mean, obviously the issue in India was the migrant workers, and they're more likely, I would say, in India to be consequences of the way they were treated than probably the virus itself. I mean, it remains to be seen, but that looks likely. And I think that might start another conversation in India, which will be interesting. But in terms of maternity care, I mean, what's great for midwifery is that the government of India is totally signed up to midwifery and wants it to be rolled out because it sees the benefits. So in terms of this particular session, leadership in midwifery, I think that there's a huge opportunity in India for leadership to drive midwifery forward, and not just midwife leaders, but obstetrician leaders and public health leaders, you know, in collaboration. So I think India, for me, India is a hopeful story at the level of midwifery. We'll see what happens in terms of the economics.
So Macdonald?
Was that I've lost the train of thought on that one. I was listening to Soo in India, and I can't add anything to the Indian story. I was thinking about keeping the heat on politicians, probably the thread that's coming through, and how we could do that without being aggressive and keeping our humanistic niceness.
Well, we've got a Prime Minister who's had some recent experience of all of that. I don't know whether
nursing and midwifery too.
Nursing and midwifery in both cases.
Yeah.
Can we just talk for a minute about what's happened in education, particularly student midwives who've stepped back up into clinical roles, some of whom may have been nurses before in any case, in the second and third years? I don't think that's widely understood, and how quickly it's happened, understood by the public and things. Soo Downe, what are you seeing on the ground? Because you must have gone through a lot of the changes in the university context.
Yeah, I mean, I don't teach undergraduates so much, but they're definitely being offered the opportunity to go and work clinically. And I do find it quite interesting. Again, I don't know how Sue Mac and Lesley feel about this. I remember I'm a direct entrant, so I'm not nurse trained. And I certainly remember in my second year being left in control of a whole postnatal ward as a second year student. It was quite like normal. And, so I think it's quite interesting that they're being given, I mean, obviously difficult times, but they're being given this level of responsibility in their third year. I think it's probably quite good, actually, as long as students are properly supported and as long as they're not under pressure to do it. I suspect it might be a way of them really beginning to understand, you know, before the end of their training, what it means to be a midwife. And again, I'd be interested to know what Lesley and Sue Mac think.
Yeah, I agree, actually. I think I wouldn't ever want students to be treated the way we were treated, because it wasn't necessarily always a good learning exercise, but there is something about that step that you make as a student or a senior student into becoming a practitioner. And maybe the steps the students are making now will help that step, because they'll still be under supervision, they'll still have support, but they'll be allowed to do more under that supervision because they're there and they're being used not as pairs of hands, though I suspect some might feel as though they are, depending on the level of support they get. but on the sort of what's coming through to me is students are actually feeling very much part of things, and maybe that's one of the things that we lost in the move into universities, where students didn't feel as though they belonged to anyone, and maybe at the moment they're feeling more as though they belong to the health service. So that might be a very good transitioning moment. So I'm seeing that as very positive.
Yeah, and I think the interesting thing would be to give them time to reflect on that when they come back, and learn from, again, are there things that we can learn as educators that we might want to build in future, perhaps, that are about recognizing that a lot of the people that come into midwifery, particularly direct entrants, are people who've got previous careers, who actually have a large degree of capacity and competence, and perhaps we should trust them with that a bit more.
Yeah.
Well, on that note.
Okay. I was just thinking, some of the students who were nurses and are now doing midwifery, I think they have more of attention, because I've heard some of them be saying they feel as though they ought to go back to nursing for the time of the COVID, but instead of focusing on midwifery. Sorry, Neil.
Well, I think Mary Renfrew said this morning that she was amazed at the speed at which nursing and midwifery education turned around, got their courses online, had people going back onto clinical duties and things. And I'm sure Soo Downe will have noticed that some other parts of the university system have struggled a bit more. So I think there is definitely something organised in midwifery. So a great thanks to Lesley Page and to Professor Soo Downe for joining us today. Some really interesting insights and an international perspective. So we should all watch carefully and quite a bit of an optimism about what might happen in India. But leadership, not just management, leadership, says Soo Downe.
Thanks for watching this video from the Maternity and Midwifery Forum. For more expert opinion and analysis, hit the button below to subscribe.